Hi, welcome to Socialpost Health Channel. I am Dr. Chava Anjaneylu, Senior ENT Surgeon. Nowadays, snoring is very common problem. That means sound during sleep. Many patients have sleep disturbance and daytime sleepiness also. Snoring especially it will cause life-threatening condition, very serious health problems if it associated with the less oxygen levels in the blood. Especially if hypoxia with snoring will cause the heart problems like cardiomegaly, heart attacks, pulmonary hypertension, and it leads to stress. Both together cause the diabetes, stroke attacks. So it causes all life-threatening problems if it causes hypoxia in blood vessels. So if any patient with snoring, we have to go to doctor and get a proper evaluation. Usually evaluation is nasal endoscopy, laryngoscopy, polysomnography test, that is sleep study test. Nasal endoscopy and laryngoscopy will tell you the problem, any anatomical problems in the nose, throat, that is deviated nasal septum, turbinate hypertrophy, adenoid hypertrophy, pharyngeal wall thickening, epiglottis problem, base tongue problem. And sleep study will tell you if the oxygen levels are less than 70%. Sometime around 70 to 80%. It is not good. It will cause long-term problems like cardiomegaly, pulmonary hypertension, where patient will have the risk of sudden death also. Usually in children, this snoring problem is due to adenoid and tonsillar hypertrophy. Usually in adenoid tonsillar hypertrophy, we treat with the medicine. Some kids will improve. In some children will not improve. There we have to do the surgery, remove adenotonsils. There is no complication at all. In middle age, nowadays many people we are seeing snoring in obese patients. First we advise them to reduce the weight and some snoring exercise. If it improves, fine. If it not improves, we do the velopalatopharyngoplasty surgery and snoring will improve. And in some patients there is epiglottic pathology, base tongue pathology. There also we can correct with the surgery. So most of the times the snoring problem is surgically correctable. If you want to use CPAP machine also, if after surgery the CPAP machine effectiveness will increase. So if you are having problem with obstructive sleep apnea syndrome or snoring, contact Asian ENT Care Center where they will give proper advice either for exercise, weight reduction and needy surgery.